I am Shannon Weber with Hive, a hub of positive sexual and reproductive health. And it's September 2015. We're here at San Francisco General Hospital. And I'm here with...
I'm Dr. Stephen Mansell. I am a postdoc at UC Berkeley, and I'm here to talk about fertility.
And tell me about where you came from and what's your expertise in fertility. And
Sure. So I originally did my PhD in Scotland. I did it in reproductive biology, where I was looking at male fertility and ways to improve sperm function. I am currently at UC Berkeley looking at very similar aspects of the sperm's electrical properties and whether we can control the sperm fertility based on those electrical properties.
I was so excited when we met because we've been looking for a sperm
Yeah.
expert. We have lots of sperm-related questions.
Yeah.
And so we're going to make in this first video an overview of what are all the assisted reproductive technologies. Sure. And this means assisted reproductive technologies when someone goes to get help to try and have a baby. And obviously at Hive we're talking a lot about couples where one has HIV, but the procedure's the same. And so we're going to talk about these different terms overall, what they mean, because it's kind of confusing, the different steps and the names that go with them. So first of all, any assisted reproductive technology requires a process called sperm washing.
Yes.
What is sperm washing?
So sperm washing is a procedure that allows you to remove the sperm cells from the seminal plasma. So the seminal plasma, or the semen, has a lot of goodies in it. It helps protect the sperm cell and allows it to induce motility, but it can also prevent fertilization if it's left in there for too long. So sperm washing is a way of removing that. Typically what is done is you do a density gradient, which is basically you put the sperm cell semen on top of a column of different layered solutions and you spin that. And only the best quality sperm will get to the bottom, and then everything else is left out and washed away.
And so in this procedure of sperm washing, those best quality sperm that are left at the bottom are then used in one of these upcoming procedures we're going to talk about. This is an important process when the man is living with HIV. So again, this is the procedure that's done for everyone, regardless of their HIV status, to prepare the sperm for assisted reproductive technologies. But it's particularly important because we understand and believe that HIV is not in the sperm itself, but in the seminal fluid. And so when this happens and you get the highest quality sperm, not only do you have the highest quality sperm, but you have a really reduced risk of having any HIV with it.
Yeah, it's a good way of removing all the seminal plasma and a good majority of the viral load.
Okay, great. And I wanted to ask one other question about this, which is people will often ask, why can't you use fresh sperm for these procedures?
Okay. So there's a process that the sperm has to go through. Sperm cells can't fertilize an egg straight away. They have to go through a process of maturation, which usually takes place in the female reproductive tract. This process is known as capacitation, and it allows the sperm cells to undergo different types of motility movements, and this allows them to get through into the egg. What happens if you leave it in seminal plasma is the motility of the sperm cell goes down, and they can't go through this process.
So they're not mobile enough. So like some people...
Well, they're moving, but they don't go through a different type of motility. So they swim like very progressively, very straightforward, nicely. But when they capacitate, they go what's known as a hyperactive motility, and this allows them to get into the egg.
To get into the egg. Okay, interesting. Okay, so let's talk about the different. So once you have washed sperm, there's 3 different processes you can go through to get the sperm to the egg.
Yes.
They have shortened names called IUI, IVF, and IVF-ICSI. All kind of confusing.
Yeah.
Let's start with this first one, IUI, which is known as Intrauterine Insemination. Tell me what this is. I've got the washed sperm, then what?
So IUI is basically for people who have very mild infertility or idiopathic infertility. And what it involves is once you have the washed sperm, you take that sperm and you put it into the uterus. And this bypasses the very lower portion of the female reproductive tract. And once in the uterus, the sperm cells undergo their normal process of fertilization.
They do their work. And how, when you say you get in there, I mean, how is it, does it have to be a certain time of the month? Should the woman, we do know she's fertile? And 2, how does it get in there? Is it a tube? What's happening?
It's kind of like a tube. So usually what you'll go on is you'll go on an induction protocol to try and improve your chances of ovulation.
So this is for the woman. She's going to have a process to Heighten her fertility.
Yeah.
Okay.
So you'll induce ovulation. Your doctor might prescribe you like Clomid, which is a generic name. And in terms of actually getting in there, it's just with a little catheter that goes through the cervix and into the uterus. And it's just released into the uterus.
So this is through the vagina to the cervix. This is not painful.
No.
It's an in-office procedure.
Yep.
Okay. And intrauterine insemination is best for people who have, what did you call it? Limited fertility,
So
or
they have very mild
fertility?
infertility, or there doesn't seem to be a cause of the infertility.
Yeah.
So the man has normal sperm count, good motility. The female doesn't have any obstructive disorders of the fallopian tubes. It's usually the first step that people will take.
Yep.
It's usually pretty cheap.
It's much less expensive.
And people will go through this.
Yep. And for people with HIV who don't have other fertility issues,
It's a
and
great
maybe
option.
don't have a timeline about how long they or soon they want to get pregnant, and also related to finances, it can be a really good option.
Yes, that's right.
Okay, so next step, IVF, in vitro
Fertilization.
fertilization. So now I got the Washburn mallet.
Okay, so this is the next stage of fertility treatment. So this is people who've maybe gone through IUI and have not fallen pregnant. And what happens is you basically take the egg and the sperm and you put them in a dish. So you bring them in close proximity and then you allow them to do their own process. Your embryologist will do an artificial capacitation. So they will prime the sperm cells for you.
So that I got lost. Artificial capacitation
Yeah.
and priming the sperm cells. What
So-
does this look like?
Oh, so basically what you do is you just expose the sperm cells to a different type of media. So it's kind of mimicking what would happen in the female reproductive tract. And the sperm cells will
Nothing could
undergo-
be that good, though, we know.
Well, it's pretty good. It's pretty good. We've got there. Did it. So yeah, it's just bringing the sperm cells and the eggs in close proximity. So it's just bypassing all the barriers that would normally happen in the female reproductive tract.
And then you're able to watch that and see how many sperm and egg get together, or what?
So typically you'll have a number of eggs in a dish, and you will introduce the sperm cells into that dish, and then you leave them overnight. And then the next day you can come back and see what the fertilization rate is.
And what is the range? There can be 0 to how many fertilized?
Oh, it really depends on the fertility of the patients. Typically, you will get good fertilization if you have a healthy eggs and healthy sperm. There doesn't seem to be anything wrong. Fertilization should be pretty good.
And what does pretty good mean? Like how many? What's the number?
Maybe, well, it really does depend on the patient, but typically it can be 70 to 80%, sometimes more.
Oh wow! And so then those are. So now we have the sperm and the egg together. Now, how does it get into the womb?
Now, how does it get into the womb? So your embryologist will culture these eggs, or will culture the embryos over a period of time. Sometimes it's 3 days, sometimes it's 5 days. Once they culture to a normal, healthy size, and they've graded them, and they think, okay, this is the best one that we have, they'll take that embryo and put it into the uterus.
So again, this is going to be similar to IUI. The woman will have gone through a process to make sure she's fertile.
Yep. The lining of the uterus is ready for the embryo, and they'll put it back in there.
And is it the same kind of tube process that it's inserted, or is it more invasive than that?
No, it's very similar.
So it does not hurt?
No.
Okay. All right, so now IVF ICSI.
ICSI, yeah.
In vitro fertilization, cytoplasmic
sperm injection.
I almost always trip up over it.
Yeah, I mean, it's typically just referred to as ICSI, otherwise everyone has to say everything out. But yeah, ICSI is for severe male factor infertility. So patients who have very, very low sperm count, the sperm don't move, the sperm aren't able to get into the egg. And basically what it is your embryologist will take a single sperm cell and inject it directly into the egg.
So it's doing the work for the sperm. I'm getting now with those first two procedures, even in the second one where you kind of mimic the female reproductive tract, it's like the sperm is still doing a decent amount of work to get into the egg.
Exactly, yeah.
Okay.
So with each procedure, we're removing barriers so we can get our best chance of fertilization. And
so the embryologist injects the sperm into the egg and does this for a few sperm and egg, or one?
So it's one sperm and one egg, and he'll do it with as many eggs as you have and as many sperm as you have.
Okay, got it. And then those are placed inside the cervix, like how I'm adopting your language.
Yeah. So
similarly, or is it more invasive?
No. So what happens is once you've collected the eggs and you've injected them with the sperm cells, they're done. They go through the same sort of growth as you would for IVF,
Right.
usually 3 or 5 days. And then those embryos will be put back into the uterus in the same way that you would do IVF.
Mm-hmm. So I know that this is all really dependent on patients, but generally, what are the chances of getting pregnant with each of these? Because it's a lot for people to weigh out, considering what route they're going to go. So what do you generally tell someone about IUI, IVF, and IVF-XC?
So the thing is, it really does depend on, one, the female age, and the quality of the eggs, and the quality of the sperm. Typically, it will range between 30 and 40%, sometimes even higher. ICSI has a very high fertilization rate because you are injecting that sperm.
And when you say fertilization, you mean pregnant. So not just that they got together.
That's when they get together.
That's when they get together. Is when they get together.
Yeah.
And
pregnancy is like once the embryos actually got into the female and it's starting to grow.
And what's the drop off there? Or that depends on the woman's.
It really does depend on the woman. Yeah.
Oh.
But across the board, it does, like, typically it's 30 to 40%, sometimes higher.
Wow.
But it does, like, there's very strong evidence that female age does play a huge part.
And at what age does that start dropping off for women?
So typically it's in the mid-30s that it will start to drop off.
All right, this is so informative. Is there any question that people generally ask you that I forgot to ask you?
No, I think that you
That
pretty
we
much
covered
asked
it?
everything.
I love it. Thank you so much.
No
That was
worries.
awesome.